It's just been incredibly exhausting to manage our life and to try to keep life normal for my kiddos, but also be doing this incredibly hard thing.
Dozens of women and children who claim they were sexually abused by their doctor say they'll continue to push for his criminal prosecution. A grand jury chose not to indict the former West Linn doctor. Katu's Eric Mock has been talking to all sides of the story today. Eric, you spoke to alleged victims and their attorneys.
Yeah, they told me they're very disappointed in the grand jury in Clackamas County not moving to indict former doctor David Farley, who practiced in West Linn. And that's despite dozens of victims coming forward and dozens of witnesses testifying to that grand jury. Katie Medley and other alleged victims of former West Linn doctor David Farley have been pushing for 2 years to get criminal charges brought against him. The Oregon Medical Board revoked his license in 2020, citing unprofessional or dishonorable conduct. But after 5 months of receiving evidence and hearing more than 40 witnesses, a grand jury in Clackamas County decided there wasn't enough evidence to indict Farley. Medley said she was devastated when she heard.
When we received the information that they would not be indicting him, it felt like an unreal, it felt like a nightmare. It was hard to believe that that could be possible.
In response, she and 70 other alleged victims of Farley sent this letter to the Oregon Attorney General, stating they believe the investigation was mishandled. We took questions about the investigation directly to Clackamas County District Attorney John Wentworth. He says multiple agencies, including the FBI, all contributed to the investigation. But in the end, he said, they didn't come up with enough evidence to convince a grand jury.
And with a defense of a doctor who's conducting examinations with the consent of his patients, with being in a place where, as a doctor, doctors are, that appeared to be an insurmountable legal hurdle to proceed with the indictment, in the opinion of the grand jury.
Wentworth says they could reopen the case if new evidence is presented, but unless that happens, the case for them is closed.
Disturbing and specific allegations were revealed in a new lawsuit filed today. The 4 plaintiffs accused Dr. David Farley of various inappropriate acts of a sexual nature while in his care. Some of them were minors when they alleged the acts occurred. West Linn police confirmed Dr. David Farley formerly worked at the West Linn Family Health Center, which he opened in the early 90s. Police tell Katu he's no longer affiliated with the clinic. Reports say he recently retired. And this is Dr. Farley in file video from 2016. Now, Katu is working to get a comment from Dr. Farley. We have confirmed the Oregon Medical Board revoked his license earlier this month for ethics violations. The complaint from the board states Farley admitted to taking photographs of 5 minor patients on his personal phone for educational purposes. He said he had the families sign consent forms, but they were destroyed. Now, Katu reached out to the West Linn Family Health Center, and they told us no comment. Providence Health and Services is also named in the suit, and they told us, as this is ongoing litigation, we won't have any comment at this time. Also, Legacy Health was named as well. They told us, we have just become aware of this litigation and are still reviewing the details. As a practice, Legacy Health does not comment on pending litigation.
Well, the Oregon Health Authority says the risk of monkeypox spreading in a setting like a school or daycare or a similar situation is very, very low. But I talked to a pediatrician today, the director of Boost Oregon, who says we have to remember how viruses work. It starts with one case and those numbers can grow very fast. The Oregon Health Authority has confirmed that the second case of pediatric monkeypox in Oregon is not connected to a school or daycare type setting. Officials won't say how old the child is who caught it or where and how they may have caught the virus. And because the virus spreads mainly through skin-to-skin contact with someone who has it, kids are not as likely to get it. Pediatrician Ryan Hassan doesn't disagree with that, but says kids can still catch it, and just because there have only been 2 cases, we shouldn't treat it lightly.
And I think COVID is a really good example of that, because I still remember when COVID started, 2020, and January, February, March, we're like, oh, there's no cases. Oh, there's one case. Oh, there's a couple of cases. But we've learned what geometric growth looks like. It starts out small, and then each person spreads it to many others, and it can very quickly get out of control.
OHA recommends vaccinations for anyone who's eligible, who may have been around anyone who's had the virus, or finds themselves in an environment where that virus is more likely to spread.